And we're live.
Hi, everybody. So I am super excited. I'm here with Erin Jensen. She has been doing my Botox and my lip filler for 7 years now.
Already
And
7 years?
Can you believe that?
No.
It flew by. And I think next month I'm turning 48. And I love that you still allow me to look like me. And I get lots of questions on Botox and lip filler and how do I still look like me? And so I'm going to leave it to the expert. And she's going to go over what she's going to do. Last time I was in here, I really wanted lip filler and she told me no. So you're probably wondering why I have this lemon cream around my mouth. She finally said I could.
I gave her the okay.
Yeah.
Okay, so hi guys. So I'm a PA, an aesthetic PA. I've been in the industry for 17 years.
Crazy.
And I really focus on natural looking aesthetics.
Mhm.
So I don't meet many people that want to look younger. They just want to look like the best versions of themselves.
Yes.
Really healthy skin, glowing skin, hydrated, less fine lines and wrinkles, just look like the best version of themselves.
Mm-hmm.
So it really does take an aesthetic eye to be able to determine that. What makes a 40-year-old look good? What makes a 50-year-old look good? And it's not cookie cutter, it's not filler alone.
No.
And so you have to find someone who has good aesthetic taste.
Mm-hmm.
You might go into an office and everyone in the office has a certain look to them. And if that look resonates with you, then that's fine. But if you walk in and the look just looks too much, maybe too overdone, too puffy, that's probably the look you're going to come out with.
And I find that most people who follow us or people who come to my office, they want something more natural.
Yes.
They just want a better version of themselves. What does this look like? And that's why I'm so thankful to have you down the street. She's here in Claremont, California, one of our locations. And I'm just so thankful to have you.
Oh, I'm thankful to have you too.
So.
It really starts with being able to diagnose the patient's needs first, like you do in your office. Not every patient is a good candidate for you.
No.
And not every patient is a good candidate for everything that we do here in this office. So when it comes to the face, there are 4 main layers in the face. There's muscle, fat, bone, and skin. And we have to figure out which layer is causing your issue and what is the best treatment for that layer. Okay. So sometimes when a patient has small lips, it's because there's less volume in their lips, and that's what filler helps. Sometimes it's because their jaw is not as developed. So they might need a jaw surgery in order to make the lips look bigger. So if you have a provider that's only doing lip filler on everybody, then they're not diagnosing the patient properly. So it might be softening the lower face with Botox to help relax muscles around the lips. It might be filling the lips. It might be different laser treatments. So it's just figuring out what is the best. Okay. Once the lips are full, there are less wrinkles on the lips. So that's my litmus test. For you, we've been doing your lip filler for years. I need to see wrinkles. I need to see that volume depletion before I'm going to fill your lips again. So if your lips are smooth, then I know they're full. And if I put more filler in them, it's going to bleed outside the lip. So I don't necessarily believe in true migration of lip filler. I think lip filler is overfilled and it spills over. Or if it's put in the wrong plane where it's not like stuck in that section of the tissue. Yeah. So now, when I've seen you a few times, the lips are smooth, the lips are smooth, the lips are smooth. This time you have some wrinkles in your lips.
I can feel it, especially when I put on my lip gloss. I can see it.
Yeah.
That's when I thought, I was like, she'll let me do it.
It's time. Now, you have numbing cream on right now.
I do. I have numbing cream. You're probably wondering why I have numbing cream on.
Yeah.
She's going to numb my lips on this live. And I think people want to see that. And they probably want to ask us questions too while you're doing that. Or would you rather wait?
I can talk and poke all day long. Okay. No problem. Now with the numbing cream, we use a specialized numbing cream called BLT. So it's benzocaine, lidocaine, and tetracaine. It's very potent. It's fantastic because lip filler can hurt. Your lips are sensitive for a good reason, right? You need these good nerve endings to feel when you're putting a cup to your mouth or a straw or kissing. But when we're poking them with needles, we try to diminish the pain as much as possible. It's very, very tolerable.
Yeah.
The numbing cream does swell the lips a little bit. So when we get close up on camera, you'll notice Stephanie's lips are going to be smoother and you're not going to see the wrinkles I just talked about, but it's because we assessed them beforehand and they're a little smoother and swollen now.
Okay. I'm ready to go.
I'm ready.
I'm so excited to get this done because I looked at myself in the mirror. Obviously, and last time I was here, we did a live. I actually did electrolysis on my sideburns because I didn't like how low this were. And I felt like my cheeks are raised up, my highlight of my cheeks a little different. Yeah. So I'm excited to see these before and after pictures, especially with her, because she analyzes my face. And I always stress her, where do you think I really need filler? Where do you think I need Botox?
Yeah.
And even if she told me today I couldn't do filler today, I was going to say, okay. You have to listen to her.
You know, that is some of my best Yelp reviews are Erin said no.
Yeah.
And then I think it builds trust, right?
And
if someone's trying to sell
that.
stuff, yeah.
Like people who are, there's so many people who are on the fence, just like they're on the fence of getting electrolysis. A lot of people are afraid of needles. Erin uses needles. I use a probe. I distribute electricity. She injects with Botox and lip filler. And it's very different what she does. So are we okay to do Botox today too?
Yeah, I have it all.
Okay. I asked her a question because sometimes last time we did this port, and sometimes I feel that this port, I felt like I could see myself moving more through here. But this is my own myth. I don't know. And we'll ask her and she'll tell you all.
Yeah. Do you want to keep talking or you want to work and talk?
No, let's go for it. Let's let the viewers.
Yeah.
And then Sierra's
we'll start working and then I can answer any questions. And
Sierra's going to, if there's any questions, you guys, you can see my lips right now. And I didn't tell my boyfriend I'm doing this.
He knows, right?
I'm sure, of course he knows.
Continue. Sierra, about questions.
Sierra, if there are some questions that you want to ask Erin, I know a lot of people are afraid to come into the treatment room. I get asked all the time, you know, what's Erin's philosophy on this? And if there's a question, what you're scared of, she's someone to really talk to. And I trust her whole entire team. I've had Morgan, I've had every single one of your staff here. Erin she's a trainer for all the best brands for Botox and for lip filler. She is the best in the game. And I'm not just saying that she's very humble, but she really is the best in the game. Do research, fact check everything I'm saying. Most people lie and they hype people up, but she's the real deal. So
thank you. All right. So we're just going to start by wiping the numbing cream off. Typically the numbing cream will sit on anywhere from 15 to 20 minutes. And then not only are we going to wipe the lips off, but we're going to clean around the mouth as well. It's very important to keep everything as clean as possible.
I did put on foundation and I do have a little makeup. Sorry.
That's okay. We'll wipe it off. So first step, we're going to do a little bit of alcohol. This helps degrease the skin, take off some of that makeup. It does smell a little strong. So I always warn the patients, you're going to be a little, strong smelling for a minute. So we're going to clean off around here.
This numbing cream is so strong. It's
You
called,
can't even
is it
feel
called
it?
the BLT.
Yeah, BLT. Yes,
we do this a lot with our gender affirming care cases. We always have, because you have to get this numbing cream from a compound pharmacy. It's very expensive and it only lasts for a certain amount, but it is strong.
Yeah, it works really good. Then this is something called puricin or hypochlorous acid. This is going to give an extra layer of killing the bacteria on the
Why is
skin.
Sierra laughing? What is somebody saying? I want to know. Tell me.
The woman in the green gloves is hot.
She is. Isn't she gorgeous?
I'm single too.
Isn't she gorgeous? I know. I told my friend. Okay, good. Because I told Steven, I was like, yes. Isn't she hot?
Oh my
She's
gosh.
gorgeous.
Oh my
But you know
gosh.
the best thing about her is that her soul and her heart matches the outside.
You're so
And I'm
sweet.
being very honest. Anybody who comes to her, they always thank me for me here. I know they're saying other stuff, and I love to hear this stuff. This is how live we keep it.
I'll take these kind of lives any day.
This is what we do.
Oh my
I had
gosh.
a good question come up. They wanted to know, Miss Erin, how do you feel about lip flips?
Oh, I love a lip flip. Okay, so let's talk about the difference between filler and lip flip. A lip flip is when you take a neurotoxin like Botox. You have a muscle that goes all the way around your mouth, your orbicularis oris, and it allows you to pucker your lips and it allows your muscle to smile. So when you smile, sometimes the upper lip muscle is overactive and it will cause the upper lip to flip under like this. If you put Botox there, it will prevent the lip from flipping under. Now, if you smile really big and your lip does not flip under, a lip flip won't work for you. It doesn't flip it out more, it just prevents it from flipping under. Now, as we age, you actually show less teeth when you smile. So less teeth show is a sign of aging. So as we age, typically over 45, I usually don't do many lip flips because for me, I'd rather have less of a lip and a big toothy smile than show less smile as you age. So look at like your grandma. You're going to see less of her smile as you age, but then your 20-year-old, they're going to have a big, big smile. So we're always careful with that. So if you have less teeth show, then we might add filler instead. Okay. So that's why you need an assessment. It's not like self-diagnosis at home.
And in a lot of people, there's not a one size fits all for anything, whether you're doing Botox, electrolysis, or anything. Everyone thinks, how many units? People ask me all the time,
yes,
how many units does Erin do on you? And I'm like, I have no idea. I just come in here and she assesses me. And I don't even ask because I trust her so much, but trust is earned. You really have to make sure you find a provider who you really trust, and she's the best.
Okay, thank you. Okay.
And she's hot.
You guys can come to my office any day. All right, we're going to use Restylane Kiss. Restylane Kiss is a hyaluronic acid filler. Hyaluronic acid is found naturally in your body. It's found in our bone, in our eyes, in our skin, and so it's very it has a very low reactivity rate. So it's extremely rare you have a reaction or an allergic reaction to hyaluronic acid filler. This filler is dissolvable as well. So if you do get a reaction or bumps and lumps, we can dissolve this overnight. For here at our office, it's very rare we ever have to do that, but it's a nice safety net to have that.
And would you recommend this for someone getting both lip filler for the first time? Is this something?
I would only put hyaluronic acid filler.
Okay.
Now there's lots of brands of fillers. This is Restylane. We hear the Juvederm brand. In each one of those brands, there's 7 different types of fillers. So when you come to my office or anyone comes, I have 15 different fillers to choose from. So not everyone is getting Restylane Kiss. It depends. Do you have big lips? Do you have small lips? Do you have dehydrated lips? Is there scarring to it? So I will choose it because they all have different properties. It's called Rubiology.
What kind of lips do I have?
Great lips.
She does. Because she does them. Yes. Okay.
So if we want to come closer, let's do an assessment for your lips. Okay. So for you, what I'm looking at the height of the lips. I'm also looking at the width of the lips in proportion to your face. So I always start off first by assessing the facial shape, and that's going to lead all of my treatments. So I don't know how close you are, but if you look, for you, you have more of a rectangular face that has a bit of a heart-shaped taper. So for females, we do want the face, we want the cheekbones to come out wider than the jawline. So as we age, female faces become more square. So that's why we've done some cheek fill in the past to give you a little bit of a lift. You don't have any features that are much larger or much stand outish. So it's not like sometimes people have really big eyes or really tiny lips or a bigger nose. We're trying to balance the face. So for you, your top lip does come out a little bit more than your bottom lip.
You want to see on the side so you guys can see that?
And that's just really jaw position and volume. So I do want to volumize the bottom lip a little bit more to bring them out. Yep, exactly. So that's where it shows
you can see
the bony structure.
How it affects my lip.
So sometimes patients want something fixed that's not a volume issue. Everyone looks at their lips and sees asymmetry in their lips. Maybe when you're putting on your lip liner, one side is lower or rounder than the other side. That cannot be fixed with filler. Everyone's face is asymmetrical. But if we can make the face look better overall, so understanding that it's your bony structure, it's your teeth, it's the fat, it's a muscle, making all the shape. Okay. So for you, I do want to give something that is hydrating to give that out a little bit more. But since you do have your overbite, we don't want to put too much filler up here or it's going to make you look puffy. It's going to make it look migrated because your teeth is already naturally pushing out this tissue.
And I don't want those
right
Russian
here.
doll lips.
No, not at all. Not at all.
I don't. Those fake lips.
No. Restylane Kiss is nice because it's not hydrophilic. It doesn't absorb much water. So it's not going to get puffy or go beyond the border. You don't have a great lip border on the top. So it's a soft lip border. So I want to make sure any filler I put is going to stay down to that pink part of the tissue.
This is exciting.
Is that good?
Yeah.
I'm so excited. I'm just happy she said yes. The last 2 times I came in for Botox, she told me no. I have asked twice in the last year. Now it's time. Okay. If you need a break, she doesn't need a break. I know this. Kelly, can you hand me those gold balls?
Oh, yes. Let's
have
show everyone
in the
this.
office.
Oh, don't you love them? Oh, good. Do patients love them?
Yes. Everyone loves them. Every station, yes.
These are acupressure balls. The idea is it's a little distracting pain. It's like pushing your fingernails into your hand. Your body's going to think a little bit more about the pokes than the pokes in your face.
Sarah, why are you laughing? I don't want to know.
No.
Not PG. Okay.
Okay. All right.
I look at all these comments later, y'all.
All right. So what I do is I pull up her lip a bit. Whenever you see someone inject, you don't want to see them evert the lip too much because then it distorts a natural lip shape. So I visualize her natural lip shape and I just pop it up just a little bit so I can follow that natural line of her lip. So a little pinch. Okay, so I'm following that lip border, stopping at the Cupid's bow, and just kind of slowly pulling things down. Now, when you see filler get injected, sometimes you will see little bumps and lumps while it's being injected. That's normal and natural, and you'll see at the very end, we'll massage this filler, and it will smooth out really, really nicely. So just nice, fine little strands. How's that, okay?
Yeah, fine. 10 being highest, 1 being lowest for pain sensation. I'm going to be honest with you guys. It's about a 2-3. For me, it's more being nervous about not knowing what to expect. And it's the same with electrolysis. I think most people are just really nervous. But honestly, I'm just playing with these because of, they just, it's not
They
bad.
calm me down, right?
And I'm not just saying that because she's doing it. But I'm telling you all the truth.
There are some aesthetic treatments that are much more uncomfortable, especially some laser treatments. But this one is not bad. There is numbing medicine lidocaine inside the filler. So once we get started, it's not bad at all. And then turn this way towards me. Good. Okay, so just giving a little enhancement to the Cupid's bow.
Am I bleeding a lot?
No, normal.
I try not to drink wine last night. Shabbat.
Already there.
Good. Yeah. So
So
see
good.
that
Can
nice.
you guys see the difference? And it's just subtle. Let me put my head straight so you can really see it.
Yeah, and they're swollen. Like that's swollen. That does look, and it's normal when we're injecting. That's going to look a little swollen, a little bumpy. You'll start to see this little ridge at the end. It's just from the pokes itself. Good. Okay, hanging in there.
Mm-hmm. Yeah, great.
Okay, I want to move to the other side.
Thank you. Any questions coming in?
No questions.
Okay, doing great. Little pinch on this side. Little pinch. When you come in for a lip filler treatment, by the time you come in, we discuss, we say hi, put numbing cream on. It's probably about a 30 to 45-minute process. When you're done, you can look swollen, a little bruised, a little red. If you don't care, you can go do whatever you want afterwards. But if you do care, it might be good just to go home that day or just have a more of a low-key day if it's your very first time doing it. Yes, like this is not what your lips. This is swollen right now.
How often do you have to do it? I think meaning lip filler.
Yeah.
Mm-hmm.
So the very first time you do lip filler, you will feel like it lasts about 6 months. And then once you do it, when you do it multiple times, it will last longer and longer. So the first time, usually about 6 months. The second time, maybe 9 months. And once you've done it a few times, I have patients that haven't done it for years, and your body just holds on to it for a long time.
This. And I think the last time we did this was 2 years ago. I think the last time we did this was 2 years ago. I really did it.
Mm-hmm.
So my body held on to it for 2 years.
Yeah. And it's, we fill up your gas tank, and over time the filler is going to slowly be absorbed by your body. Sometimes you might want to come in when your gas tank is half empty. Mm-hmm. Some people like to wait until everything fully empties out, and it's really a personal preference.
Mm-hmm.
That's a good little analogy. And then another question, do you have to be a nurse to do injections correctly?
Oh, great question. It depends on the state. Every state has different licensing. Typically, I would recommend an RN, an NP, a PA, a physician in any state that you are in. Mm-hmm. There are some states where a doctor can kind of wave a little magic wand over you, no matter what your qualification, like a medical assistant or esthetician.
Really? No way.
Correct. Yes, like in
that's
Colorado. And yes, you can. Yeah,
that's not even allowed. Is it going to ruin my filler by talking with you? No. A doctor could wave a wand and say, "You're a medical assistant, and you can do lip filler."
In some states, yes. So that is one thing that I think you need at least RN education to do. I think it really is the safest thing to do.
Yes.
And also too, what I'd recommend is that it's not necessarily the specialty that makes someone an expert. It's how often they do this. So all I do is Botox and filler all day, every day. And someone like that is most likely going to be more experienced than even a surgeon who's doing lip filler once a month. But you don't want me to do your boob job, you know? So you have to find, that what is someone's expertise.
You have to do the homework on people. Yes. People who I always say, if you pay cheap, you get cheap. If you pay cheap, you get cheap. There's a reason why people have a certain price tag. And I always say there's not a one size price for everybody because it's different. And she's choosing from different fillers, different Botox. And you really want to go by someone's expertise and who has trained them. Mm-hmm. So like everyone on her team here at the treatment, I've used them all. And they all do. Lindsay, Angela, Morgan, I know them all. Annie, I know your girls. I send all my people to you guys because I trust them because they were trained by her. So,
have you been involved in the whole Lip King debacle in Rancho?
I've heard about this. You guys want some tea on this?
Okay, so there was a nurse in Rancho called the Lip King, and he was pretty popular on TikTok. And he would do all these very natural looking lip injections. Well, one time, one of the patients came back and she didn't see any difference. So she started to do this research and found out that all of these patients didn't see a difference.
Oh, wow.
And so she filed this report with the Consumer Affairs, and we actually saw her here. We did an ultrasound on her, and she didn't have any filler in her lips.
That's wild.
So I think this guy was, you can do something where you backfill filler. So this is a filler that comes in the syringe from the manufacturer. These are different syringes we use. We can fill these with filler, and sometimes we will for more control in certain areas. But he was filling all of his filler in these backfilled syringes, so no one ever saw the real stuff. So I theorized he was using very cheap filler, charging cheap prices, and just using like a tenth of a syringe. Because when you poke the lips, it's going to get a little bit more swollen. So we saw tons of Lip King patients. And so these poor patients, they were out all this money because they spent, even if it's a discounted price, they still didn't get a result. Yeah, exactly. So it is better, I think, to go more quality for this especially. Yeah. All right, now we're going to work on the bottom lip here. Again, very swollen right now. It will settle down, but you can start to see that nice shape start to take form. In this area of the lips, some patients have enhanced tubercles where they're little pillows of the lips. So we give a little bit more fullness in the center. Some patients have two separate tubercles. Some have them joining together. Hers are a little bit more joined together. So we're just going to softly enhance. I don't know if you've seen, sometimes people put a string down the bottom lip to make this like keyhole pout. It never works if a patient doesn't truly have it. You can't create it because then the filler just sits in these weird pockets that aren't natural. See, we're starting to see a little more color to the lips. The lips look like they have more blood flow.
I have a question. How can someone get a assessment for lip filler with you?
Oh, fantastic. You can go to our website, getthetreatment.com. There's a book an appointment button in the top right-hand side. So you can do it online or you can call the office. The phone number is there as well. And so you come in for a cosmetic consultation. We can do filler the same day if you're deemed appropriate for it, or we can also schedule it out too. Oh, nice. Some patients just want to come in and talk and have a game plan. Some patients are very, very excited to do things the same day. There's some treatments, such as laser treatments, that we can't do the same day because there's more preparation for it. But Botox and filler is usually a same-day treatment if the patient wants.
And what filler are you using again?
This is Restylane Kiss. Restylane Kiss. Hyaluronic acid made by Galderma.
We do one thing. We're in Claremont, California in Los Angeles County. I want Erin to know around the world how many people are watching right now. Will you guys say what city you are from? No, what state you are from if you're in the United States and what country you're in. I want Erin to hear this. So let's see. This is where Sierra gets nervous.
I love this.
Sierra's getting a little nervous. Where are you guys watching from?
All right, close your mouth for me. Good. So now I'm looking at the front of the lips. I'm looking at the side. Remember, I wanted to put more in the bottom to bring it forward. So I still want a little bit more coming down.
Georgia, London, Dallas, South Florida, Ireland.
If you were in London, one of my providers, Courtney Too Good, is moving to London, and she's a PA from my Newport office. So you can go see her. I know. So that her husband's from there, so they're moving out there. Very excited for their next adventure.
Upstate New York, Kentucky.
How you doing? Okay.
I'm great.
Is anyone ever allergic to HA?
It is a possibility. In my 17 years of practice, I've never had anyone be allergic to hyaluronic acid filler. There's never say never. I think more likely it would be what's binding the filler together or other ingredients in it. But no, I've never seen an allergic reaction to it. Now, if you have autoimmune conditions, lupus, rheumatoid arthritis, we are a little bit more cautious with it because you can have an increased reaction to anything. Your body's just hypersensitive. So if someone is not doing well, I have IBS and I just changed my Humira dose and I was in the hospital 3 weeks ago, then it's not a good time for filler, but everything's stabilized, and then it's kind of fine to proceed.
That's what you're paying for, that kind of knowledge. Like when you think about IBS and in your mid-40s, when your body is changing, all these things are happening. People you're paying for her knowledge. You're paying for the expertise. It's worth every penny.
This is a medical treatment. This is a medical procedure that can have big complications with it. So you just have to go to someone who is able to manage the complications. So at our practice, we have ultrasound. We can see if the filler is causing an issue. We have the dissolver on hand to dissolve if we need to. We're prepared. And it's not, stuff's going to happen. Complications can happen. And I don't think it's if a complication happens, it's how does your provider handle it?
Yeah.
Right? Accidents happen. Stuff happens.
Every single day.
Yeah. But you just want someone to
It's
be able to
more
take care
of people, not for me in my practice. I don't know if it's the same for you. It's more people not following the pre and post care, not following how to prep for the appointment or the post, you know. And so I think that's a big factor for us. I don't know if it's the same for you.
I mean, it can be, but you know, I think any part of the process, right? Like something could happen. Everyone's body is different. Everyone reacts differently. So this is now when I'm just hyper examining. Do I want this? I want this Cupid's bow up just a little bit more. So I'm going to come in and put a little bit more up there. And then I'm just seeing how much filler I have left to work with. Close your eyes for a second. Open here. So this kind of helps bring up that Cupid's bow. Smidge.
Can you wear lip products same day as getting filler, or should you wait?
You should wait. It should be clean, like a clean Aquaphor that hasn't touched anything. You don't want a chapstick. Or there are some recovery products like arnica gel. Some different brands make them. If your provider okays it, then it's fine. But you don't want just something that's already been on your dirty lips already. All right, last few little bits. We're going to come down here and just give a little bit more volume to the center. Oh, sorry.
I love things like that, don't I? Whenever we make mistakes, these are gold. I love it. You're done. You're not gonna try.
I'm done.
You look great.
Can you get a lip blush after fully healing? Sorry, train.
Oh, I know our train. We love our Clermont train. Yeah, you can. Yeah, I would wait 2 weeks. About yes.
What is that procedure? What is that?
It's like lip tattooing, like I'm blushing.
Oh, yeah.
Yep.
I used
like
to
almost
do
like
that.
lip tinting.
Yeah.
Did you used to perform it?
Mm-hmm.
Yeah. Those lips get swollen.
I got it done one time, and I was going to dinner with people afterwards, and they were so swollen, and I was so embarrassed. I have a photo of it, and I can't believe I went out.
Who cares, right?
It was really bad.
It's more so you feel bad for the other people. You know, they're like, "What happened?"
Yeah.
Okay, hold on. So I'm gonna go grab. Oh, I'm not done yet, but I'm gonna get a little arnica gel. We still got your Botox to do.
Gel. We're still gonna do. Sorry, I have numbing cream on my lips, and it's hard for me to talk sometimes. I'm so sorry. Isn't she amazing, y'all? I mean, honestly, I think we always ask. Everyone always wants to know pain level. Like, how painful is this? Honestly, a 2 to 3 out of 10. It's not. I wouldn't say it's painful. It's just a pinch. And don't forget when she is putting in the filler. There's also a numbing cream as well. I can't talk right now. I feel so.
Oh.
Am I bleeding?
Hold that for a second. Hold on, I get my other glove on.
Am I bleeding?
Everyone's like, you're dripping.
Oh, right here.
I'll grab.
God.
Okay, so
don't make me laugh. Is it bad to laugh with lip filler?
No, it's fine. So, okay, one other.
We're demything all of these.
If you're watching injecting videos, okay, this is like a pet peeve of mine or a pro tip. So I just injected your face, right? My gloves were covered with blood. Mm-hmm. Sometimes people will go grab stuff out of their pockets with dirty gloves on, right?
Isn't that crazy? And they don't change
it's
gloves.
Crazy.
I know.
So you can see I took off my gloves because I need to get my arnica gel, but just make sure if your injector is touching stuff and they touched you, that's gross.
Same with electrolysis. If you guys watch me on my lives, I change. I have pink and I have blue gloves because I even tell the camera, I tell the people, I'm changing gloves and I'm changing color because I'm changing things. I'm touching things because everything in this office is sanitized. Everything is clean. You come into a clean office, you know it. So that was hilarious. That was all blood. That was so good.
You're like going on a soapbox and it's just
you're like, wait. Okay.
That's how real we are. This is what we do around here. We want this to be real. We want people. So many people are afraid of doing lip filler because they're afraid of the unknown. And we wanted to really come and bring. How lucky are we to come into the treatment room that she was open to do this with y'all?
Okay, so some of you at home might be like, oh my gosh, those lips look terrible. They are so bumpy and weird and swollen and red. Yes, it's part of the process, okay? This is not going to be the final result.
No.
We can see through it because
Yeah.
we've done this before.
So what I'll do is, I'm going to post 24 hours in our story. So if you're watching right now and you're not following us, we're Rubiology Official, but her company is called The Treatment. And so I'm going to get pictures from what they took of my before. And then you guys are going to see me how many days, when do you think I should expect the lasting, like
2 weeks, they're pretty settled. Yeah.
2 weeks.
2 weeks. Yes.
Okay.
Okay, fab. Okay, lips are done. Now we're going to work on your Botox next.
And I have a strong brow. This brow, no matter what, like you said, all faces are asymmetrical. And for some reason, it doesn't matter. It's my brow. Even right now, do I have any Botox still left, do you think, from April?
No, probably not.
And look, it's still. And so sometimes I have to come back and she'll lower it just a little bit. And sometimes it doesn't do it, but I get like the Spock. I get like that, like.
Yes. Also, why that happens is as we age, you start to lose volume in your temples. And when you lose volume in your temples, 20 years ago is like a little pillow supporting your eyebrow. Now it's more of a quilt. So since it's thinner, you can wrinkle a quilt much more easily than you can wrinkle a pillow. So over time, if the eyebrow is still spocking, we could go in and add temple filler to kind of plump that up a little bit too. Yep. So now we're going to do Botox. I know earlier you mentioned Botox versus Dysport.
Yeah.
There are 6 or 7 neurotoxins on the U.S. market now. We carry the top 2 mainly, Botox and Dysport. We do a little bit of Daxxify and Xeomin. I don't use it very much. I think Botox and Dysport work the best. It's kind of like Coke and Pepsi. I think they're very similar. They're a same price point for us, same side effect profile. So it's really a personal preference. For you, I don't think it's a Dysport. I actually think you just need more units. So over time, you sometimes need a stronger dose. We might need to do a little bit of a different placement. Older. We all are.
Yeah, right? It's happening. Yeah. So and I can see it,
Yeah. So we're going to switch to Botox, but I'm going to do a little bit of a stronger dose as well.
Let's go for it.
Okay. All right. So up here, we're going to treat the upper face. We're going to treat the frown lines, the forehead lines, the crow's feet around the eyes. And we're also going to do a brow lift, a Botox brow lift. And some people think brow lift and think they're going to get like crazy Cruella de Vil, but we're just going to kind of soften and help lift everything up.
Do people ever ask for that?
Sometimes.
Yeah. That guy looks like Jeff Bezos. Sorry.
I don't know if it's good or bad to have him as a patient.
There's before, after pictures, and I'm like, all I can see is Jeff Bezos. Sorry.
Okay.
That's my ADHD. The full effect.
Okay.
I know what happened. I ate the
Make a frown for me. Good. Go and relax. Okay, little pincher. So I'm going right into the muscle. This is the procerus muscle that's connected to the corrugator muscles. Make a frown again for me. Good. So you can see where that tail of the corrugator pulls down. And then she has her head of the corrugator pulling down as well. So we're going to go right above the brow. This will help with the frown line. It will also help lift up the muscle. Good. Turn this way a little more for me. Good. And make a frown again. Because I'm always looking at my patients in animation just to double check where the muscle placement is, because every patient is a little bit different. And I'm at a little resistance there, so I'm just going to move over to the side.
What does the resistance mean?
That's a little unusual. Do you have a scar here? Any scar? No. Sometimes the muscle might have been really thick right there. Good. And then raise up your eyebrows. Good. And then relax. Good. Okay, this one gets a little spocky, huh?
Yeah.
Okay, well, watch it. This is a balance though, because we don't want to go too heavy on the forehead. You have a shorter forehead, and so it's more likely to drop you if I go too low on your forehead. So sometimes if you get an eyebrow that's a little bit higher, it's okay. It's something we sometimes do just for safety, because if you got too heavy, we can't take it away. It's just going to take time to fade away. Raise up your eyebrows. Good, relax. My hand's getting in your way. Good. Right. And then close your eye tight for me. Good, close. So you can see when she closes her eye, the tail of her brow pulls down. And then watch when she relaxes, and then relax, it goes up. So if you do that when you close your eyes and you put Botox around the eyes, you're going to get more of a lift to the eye. So
have you ever done a brow lift on me?
A little one.
A little one?
Yeah. You know what? We do frown, forehead, brow. And do we do something down here?
Mm-mm.
No, right?
We've
Yeah.
never
Yeah. It's
done
just,
that.
you just need a little.
And we've never done filler on my cheeks.
Oh, we haven't.
We've never done filler on my cheeks.
Oh, okay. Okay.
Yeah, I was just thinking we've only done my lips, and we've only done around here.
Oh, yeah. Well, then your cheekbones look good.
And this is me.
Blessed.
I have to say it because I'm always going to tell you guys the truth.
Yes.
And when she was thinking that, I was like, I've never, unless I blacked out, but we've never.
No, you know that.
I'm like, we've never done filler on my cheeks, not yet, because I always ask you.
Yes.
I do always ask you.
Good. Maybe that's. Okay.
I do always ask you. So
Okay.
I'm just always going to keep it real, y'all.
Okay, turn this
But if
way.
she told me I needed it, I would let her do it.
And so when I tell my patients that too, like, what do I need? Nobody needs anything, right? But I tell my patients, if your budget allows, this would look really nice. What I don't want people doing is, if their financial situation doesn't allow for it, them to obsess on it.
Yes.
There's other things. There's a lot of
you
life.
work within the budget. And
100%.
she talks about that.
Yeah.
One of my favorite parts is coming in and being, the treatment that they give you, the service, they really give you the white glove service here. They really make you feel special, but seen. And that's so important in this beauty industry, and to be heard,
Yeah. We only make recommendations based on what is bothering you.
Mm-hmm.
We're never going to bring up something to do to your chin if your main concern is your crow's feet.
Mm-hmm.
It's part of a bigger conversation, but we're not going to push or say other things.
They never oversell. They never, she tells me no more than anything. So
Why do some people get more bumpy than me? Like, why does she get bumpy?
Yeah, it's just, the different layers of the tissues, how thick they are. Sometimes we have to go more superficial in the muscle and for Botox for different reasons. But these bumps go away in like 10, 15 minutes.
yeah, this will be gone. And sometimes it's normal to get bruises. Sometimes there's so many veins around here, and you can get bruises. It's part of it. And it's just a blood vessel, right? It's just a bruise.
That's
so.
it. All right, you look a little beat up, but it's
I'm
gonna look
a
good.
little beat up. So if you guys, the question I really want to ask, so can I get electrolysis tomorrow on Monday if I wanted to after a lip filler? That's what we get asked all the time. Somebody comes and I had lip filler yesterday, or I did chin injections. I did filler in my chin, and people always want to know. This is really why we're here. People always want to know, what do you recommend, Erin? And I always say to go and ask the provider what they recommend, because I don't know what people are putting in you. So you have to, no matter what, always ask the provider. But if I found some hair on my lower lip, my light flavor saver down here, and I found something because I saw the live and I was like, holy crap, there's all these hairs down here because I'm going through menopause and it's happening. Could I get electrolysis tomorrow?
It would be best to wait 2 weeks.
2 weeks
would be best.
Okay.
Now, sometimes life happens, right? Where they have someone has an appointment 10 days later. I think there's sometimes exceptions can be made. If you do have those autoimmune conditions and, we're a little bit more risky, let's wait. Because what we don't want to do is that you have a very sterile process. I have a very clean process. But anytime bacteria or there's inflammation, that can kind of mess something up.
Yeah.
So we are especially cautious with dental work.
Okay.
Dental work is a hard no.
Okay.
2 weeks before lip filler and 2 weeks after lip filler, because there's so much bacteria in our mouths.
So would that be 2 weeks before electrolysis too? No lip electrolysis around here 2 weeks before a filler appointment? You bring up a good point. What would you recommend?
I don't mind before. I'm fine with before.
So you hear that? So before if you want to get electrolysis, like I could have had electrolysis yesterday.
Yes.
But not today, not the same day, and come in.
Yeah, probably the same
day. You have
day.
to be so specific with people, because
yes,
people,
you do.
especially on TikTok, everyone's an expert now. And I tell this on every single live, fact check us. People are always saying things, but you have to listen to your own instincts, because so many people are just going to sell you. Yes. You have to listen to your instincts. So the gold standard, I think, should be, listen to Erin 2 weeks after, whether you get lip filler. What about chin filler? And they want me the same. Correct.
Safest is 2 weeks.
2 weeks.
Yes. But electrolysis before is fine. Now, if you had electrolysis the day before and you came in and we're seeing lots of redness, lots of erythema, maybe some little scabs, maybe you're just really reactive, then we might just say no.
Yeah.
And what I learned during COVID, oh my gosh, before COVID, I worked sick. I did treatments on everybody. Like I thought all this was a life or death situation. Yeah. Then during COVID, I realized, look, it's okay. Lip filler waits 2 weeks. None of this is urgent. So we just want to make sure you're in your healthiest state to do these treatments, because the last thing you want to do is deal with the complication that was preventable.
healthiest state. So I
Yes,
think
but I also understand it's a lot of maintenance to keep this looking normal,
Yeah.
electrolysis, and when do we do the eyebrows, and when do I do my spray tan, and when do I get my chemical peel? So I understand it is a lot of timing, and our lives are really busy with everything else going on.
But I think it's so important to listen to the provider, the person who has the credentials, who knows the formulas that they're putting in your skin. So we always say check with. I have somebody come in my office, and they're like, "Oh, I have an appointment. I just had lip filler," and I'm like texting you. I'm like, "Hey, it was Chen. Can she get this done today?" And we rescheduled her. And it's so important to have people that will tell you the truth. It's so important. So we answered the electrolysis question. Is there any last questions, or is there anything you wanted to add to this?
I think what you want is that with anything, you want a lifelong partner in this.
Yes.
When you think about how long have you been seeing your hairdresser for?
Gosh, 15 years, 16 years.
Would you ever go get your hair done because there was a deal somewhere else?
Never.
That's your hair, you know?
No.
Like that's your hair is very important, right? I drove to LA for 10 years for my gal.
Yeah.
So think about it that way. If you would not cheat on your hair, girl,
Yeah.
Now in my practice, everyone is so amazing. We do kind of pass around each other if needed.
Yeah.
Some patients will stick with the same provider. Some people just want to see anyone on a Saturday.
Yes.
So just think about that. You want to develop a relationship with someone that you're seeing. I recommend 3 times a year to see your aesthetic provider.
That's a good point. 3 times.
Make a recommendation.
It's about me, 3. But as I'm getting older, I'm noticing my face is changing. And so I actually came in sooner than I normally do. I used to come twice a year. And now I'm like, oh, I can see it. This is 4 months later, almost going on my 5th month.
Now, sometimes patients will come in monthly because we're working on acne scars or active acne.
Yeah.
But I think a 3 time a year baseline is good. You need really good skincare. Okay. I don't trust every influencer selling, stuff on TikTok Shop. If you have a medical provider assess your skin, they're going to tell you exactly what you need. And it might be something they sell, or it might be something you can get at the drugstore. And just find the person you want to trust, not a deal. Like this, I see the worst outcomes when you. Yeah. But this stuff is expensive too. So we have memberships. We have something called the MIT membership, where it's $150 a month, and it just goes into a savings account in your account. You get 10% off of everything. 10%
so that MIT membership builds up.
Yeah. So every 4 months you have $600.
Oh, so it's like a savings plan.
Exactly. It's like layaway.
It's like a layaway. It's like a layaway for your Botox. So that makes I've never asked you what that was exactly. And that makes sense. That's so smart.
And then you just get 10% off your Botox.
That's so smart.
Yes. So then it makes it much more doable. All of the drug companies are fighting for your business, and they have so much money. So they have Botox days and Dysport days and double points. So if you work the sales system, you can still get stuff a little bit less expensive, still with quality providers.
And that's what her sister Megan, who, if you're not following her, follow them. The treatment on Instagram and on TikTok. But Megan, her sister, goes on and Mondays with Megan, right?
She's all over. Yes,
she's kind of there. But in the story, she will tell you how to deal. Okay, it's live. Like, this is what's happening, and she will tell you the deal. I think it's so. That's why I also think. I think all your customers love about you is that people tell you the deal. You're always up there giving us, somewhat of a deal, but it's not cheap. This work is not cheap. You're paying for expertise.
Correct.
And I like the layaway plan. I didn't understand that the Mint was like going towards that.
Yeah, it's not a fee. Yeah.
That's smart.
Look, if you spend $1,800 a year on Botox, that's how much the membership is a year. But you already pay that.
Yeah.
I mean, an average Botox treatment with us is about $600.
It keeps you. You hear that? An average Botox treatment is $600.
Yes, it could be more if we're doing more areas.
And can we ask average for lips? What is average for lips?
It's $750.
Yeah, that's an average for lips. Okay, so that way you know what the price difference are, what to expect here. Okay. Anything else? Do we have a question?
Yeah. Is using Botox around the mouth area a true technique for lip fillers, or is it an upsell technique?
It can be complementary if you have small lips and your lip disappears when you smile. That could be a lip flip. Okay. You can also put Botox in the lower part around the mouth. If you have, these are muscles called your DAO muscles. If you frown and you get a little kind of like a happy face, like a little line right here, you can put Botox here, so it helps lift the corner of your mouth. Now, if someone's trying to tell you Botox around your mouth will make your lips bigger, that's not true.
We should do myths.
Myths, I love.
Because Erin would be able to.
I love a mythbuster.
Nope. Any last questions?
Just a statement. The Treatment Skin Boutique, I don't know if you've heard of them, but they said, amazing live, our queen Erin. Membership is a smart way to say it.
It is. It's super smart. It's super
Look at that.
smart.
Look at that.
Super smart. And it's okay to smile post.
Yes. Okay. So these are your post care. Here's your post care.
Post care.
Okay. Okay. Leave them alone. Okay. Don't. You don't want to get them dirty, so keep them clean.
Mhm.
You can do arnica gel or clean aquifer. That's okay. You don't need to go massage them. You don't need to go squish them. Now, anything you do to increase blood pressure or swelling in your face can make you more bruised and swollen. That could be alcohol, spicy. I'm not spicy food. That's rosacea. Sorry.
I have rosacea though.
But that's my rosacea. Should be all. Alcohol, working out, salty foods, kissing. Just like give your lips a rest and hydrate.
How many hours?
48
days?
hours.
48 hours.
Yeah, 48 hours.
So Saturday's a great day. And I want to bring up one more point, which I love the prices. I think people are afraid of price. I haven't had my lips done in probably 2 years. So when you think of like $750 on a base, that's like a base, right? A base, because it could be more.
No, pretty much all of our lip fillers are $750.
So you heard it from the queen, $750. Think of how long that lasts for the investment. And for me, I know it just makes my face look a little bit more. I look in the mirror, I know right now I look pretty. They probably look a little bit big, but they're going to go down in the next 48 hours. You're going to see, and I'm going to go in my stories, and you'll be able to see if you follow us at Rubiology Official on TikTok and Instagram. I'll post so you can see what I look like 48 hours, 72, and then the finish when it's done. I just thank you so much, Erin. Any last questions? I'm so excited about my lips. Any last questions? Anything else, Miss Sierra?
That is all.
Can you guys all give Erin some love, because Erin Jensen, PA, you can follow her on TikTok. Isn't she amazing? She has her own account on TikTok, and she also, it's the treatment.
On TikTok, it's the treatment skin.
The treatment skin.
Because treatment's taken on TikTok, but on Instagram, it's the treatment.
The treatment.
And getthetreatment.com is our website.
Okay. Well, I love you. I love you. And you know what? I have to tell you guys, a long time ago, I almost was going to close my shop, and your sister and you called me and had me come on your podcast. And you guys gave me my voice back of how to build a business, how to brand a business. And if you're thinking about starting your business or do something, you want to hang out with people by association. You learn from the best in the business. You become their friend, or you listen to them. You see how they do things. And because of her, I've been able to grow and do things, especially on social media, not being afraid to put lip filler on here and put everything out there. But I'm so thankful for Megan and you and what you've done. And I'm women in business with what she's created. She's built an empire. Thank you so much. I love you.